Welcome to Mental Health Mini number 21, where we'll talk about dementia. Dementia is an overreaching diagnosis for many different neurocognitive related disorders. In particular, it includes Alzheimer's disease, which we'll devote a different mental health mini to, Lewy body dementia, Prion disease dementia, Huntington's dementia, cerebral vascular dementia, and Parkinson's related dementia. Symptoms of dementia are going to be based on the brain area affected. So for example, if they have dysfunction in the frontal lobe, they may have impaired reasoning, impaired problem solving, poor judgment, inappropriate behavior, and aggression. If the dysfunction is in the parietal lobe, they may have impaired orientation, impaired visual spatial skills. If it's in the occipital lobe, they may have impaired language interpretation and recognition. In the temporal lobe, they may have impaired recall, improper use of language, delusions, and hallucinations. The brain area affected, if it's the hippocampus, may relate to memory changes as well as inability to form new memories. If the amygdala is impaired, it can impair emotions, and it can also impact the way that neurotransmitters work in the body. So it may cause mood changes, restlessness, sleep impairment, and agitation. Cerebral vascular dementia is a form of dementia that's often caused by a cerebral vascular disease or a stroke. When they have high blood pressure or mini stroke activity, it can impair blood flow to the brain, and this can cause deterioration of brain functioning. The main cause of cerebral vascular dementia is high blood pressure. It often has an abrupt onset and fluctuation in symptoms, and this can be very frustrating for patients because they may feel confused and then they get a little bit better and they think that, whatever was going on has stopped, and then they get confused again, and that can be very frustrating for them. As I mentioned, symptoms are going to be based on the region of the brain affected, but it can include things such as limb weakness, a small stepped gait, speech difficulty, depression, anxiety, manic behaviors, apathy, catastrophic reactions, psychosis, and pathological emotional response to things. Dementia related to brain injury is primarily caused by a traumatic brain injury. A traumatic brain injury occurs when there's rapid displacement of brain tissue that results in loss of consciousness, amnesia, disorientation, confusion, concussion, vision changes, seizures, or disorientation. A lot of times these symptoms will resolve, but if the traumatic brain injury is severe enough, other symptoms can remain, and those symptoms are the ones that would cause dementia. We also do see an increase in dementia-related symptoms if they've had repeated head trauma. Some symptoms related to brain injury dementia can include emotional lability, impulse control changes, speech changes, and movement changes. Lewy body dementia is about a fourth of the dementia cases. It develops more rapidly and progressively than other forms of dementia, and it's diagnosed through identification of Lewy bodies in the brainstem as well as cerebral cortex. Lewy body dementia does respond to acetylcholine esterase medications better than other forms of dementia. However, individuals with Lewy body dementia are more likely to develop EPS and adverse reactions if they take antipsychotics. Then we have Parkinson's-related dementia. So this is present in about 75% of patients with Parkinson's disease, and it initially develops from diminished dopamine as well as nerve damage in the substantia nigra. The symptoms of this is changes in muscle movements, tremors, and Alzheimer's-like symptoms. HIV-related dementia occurs from compromised immune system changes that lead to brain infections in patients with HIV. These brain infections can relate to dementia. HAART, or heart therapy, highly active antiretroviral therapy, is a medication that's now used very frequently to treat HIV. Because of the positive outcomes of heart therapy, we do see limited experiences of HIV-related dementia now versus in the past. Symptoms of HIV-related dementia include behavioral changes, cognitive changes, and psychosis. Huntington's-related dementia is related to Huntington's disorder. Huntington's disorder is an autosomal dominant disorder, meaning that if somebody has it, they pass it on to all of their children. This disorder causes damage to the basal ganglia and cerebral cortex, and symptoms typically start to occur in early to mid-adulthood, so 30s to 50s. We do see a progressive decline, so these individuals may have their symptoms for about 20 years. And the symptoms that we would typically see are cognitive changes, ataxia, and these chorea movements. The picture on the right kind of depicts the chorea movements, which are different contractions and muscle releases that make the body almost look like it's in a dancing position. And that's where the word chorea comes from. Then we have dementia related to prion disease. Prion disease is when there's clumping of prion proteins in the brain. And there are multiple causes of this, but typically we would associate it with Creutzfeldt-Jacobs disease, which does have a genetic component. This form is more rare than some of the other causes, though. It does have insidious onset and most commonly occurs between the ages of 40 and 60. It has the most rapid progression, so there's about a 2-year life expectancy once diagnosed. The symptoms of it are going to be dementia-related symptoms, along with coordination and movement abnormalities. Diagnosis of dementia related to prion disease is done through identifying brain lesions, finding specific prion proteins in the cerebral spinal fluid, and they'll often have triphasic waves on their electroencephalogram. Treatment of dementia is going to include a lot of the treatments that we talked about with the neurocognitive disorder. So if you want to know the non-pharmacological treatments on that, feel free to watch that video. As far as medications go, we'll often use a cholinesterase inhibitor. This inhibits acetylcholinesterase to increase amounts of choline, and this is meant to prevent progression of the disorder or to slow progression down, but it will not cure dementia. Examples of this, again, is Aricept, Exelon, and Razidine. We can also use N-methyl D-aspartate or NMDA receptor antagonist. An example of this would be Namenda. And the purpose of this is to block NMDA receptors to decrease glutamate levels and slow down damage to neurons. And that wraps up our discussion on dementia.